everyone, this is Jill Hurston with CenterZip. Welcome to our Zip Chat today. And so with that, I'm going to turn it over to our moderator, Mike Watson. Mike, go ahead.
Thanks, Jill. Welcome everyone to our Zip Chat episode 3. I'm Mike Watson, VP of Engineering. With me today, I have Hemant Alhens and Arun Mirchandani. Thank you for joining today. So the topic today is the challenges and benefits of telehealth. This is a pretty interesting topic. The more I've been involved in preparing for this, the more I've learned about it, and I find it pretty compelling. So let's just move right on. So telehealth has become a reality in the U.S. and abroad due to the COVID-19 pandemic. To say the pandemic has been a rude awakening may be an understatement. My family, for the first time, experienced an official consultation from a physician over a web meeting. It was actually for my daughter, and it was very interesting. I mean, I've unofficially had that kind of experience with my one of my sisters who is in med school, or actually she just graduated. Congratulations to her. And then, maybe one time before I had actually experienced this through like a therapy session, which actually went pretty well with a well-known therapist. So it's new for everyone. It's like really kind of hitting us. The tools are awkward, and that's kind of what we're here to talk about, is what's really going on. So we have a poll just to see if anyone has similar experiences to me. So feel free to fill that out. So while we're doing that, I'm going to go ahead and invite Arun into the conversation. Arun, from your vantage point at Vocera, are you seeing a huge trend in companies embracing telehealth? And do you see this trend continuing post COVID-19?
Yeah, sure. Good morning, everyone. Good morning, and good afternoon to some of you. Thanks for having me here. The short answer is a resounding yes. We started Vocera about 2 decades ago with kind of a very simple premise to give caregivers and the power to reach anyone by simply calling for their role and ensuring that the right person was always available instantly. No overhead paging, no running down, yelling in the hallways. And over the last 20 years, I've only really seen 2 big tectonic shifts in the adoption of technology in healthcare. Healthcare tends to be generally slow in adopting new technology. The first one was when the American Cures Act was enacted in 2010, ACA, which legislated the electronic medical record use, and along with it, the patient privacy mandates came in. And then the second one is what we're going through right now. This has been a real wake-up call, mostly driven by fear for not wanting to lose this battle to this invisible enemy. So yes.
Thanks, Arun. So Hemant, from your viewpoint and what you're seeing within CenterZip and our clients there, what are you seeing?
So the main observation, Mike, I'm seeing in the recent months is that while there has been a macro trend for a while of telehealth being a desirable way to deliver and receive healthcare, but in recent few months, it just seems like every client is needing to adjust their technology roadmap, whether they're in healthcare or not, to adopt to the realities of what we have been seeing in the last few months. So a lot of adjustment needed on their technology roadmaps to account for it.
So also, Hemant, you have an alternate viewpoint as well, because you live with a doctor, correct?
Right. I'm going to share a lot of those stories, or at least few of those, and through this session today. So in due course.
So let's bring up the poll results. Let's see what we found out here. A lot of people have used telehealth prior to COVID-19. That's interesting. And
that is interesting, yeah.
Actually, even
makes sense.
People have never used it, so that's even more interesting to me. Since we've been going on this lockdown period for several months, some healthy people out there. That's good. All right, so moving on. So, Hemant, what is your view of the state of telehealth adoption, and how has COVID-19 specifically impacted it?
Yeah, so what looks like from our vantage point, I mean, we've been working with the healthcare companies. 2/3 of our business when we do software development is healthcare companies in the various parts of the healthcare value chain, providers, payers, and technology enablers. I mean, it does seem that telehealth has been around for a while. I mean, Teladoc as a company went public, IPO, very successful IPO several years ago, and we have worked with a number of, one of our core clients has been delivering telepharmacy for a while. So telehealth has been around for a while. The only thing that has happened in the last few months is just gotten a bit of a kick to push it harder in adoption and increase the market. So the market overall, by any one of the reliable numbers, was close to $40 billion even in 2018, well before this pandemic, and is projected before the pandemic number impact was projected to be 140 billion or so by 2025. So now with COVID-19, it's going to only significantly accelerate that market. But it seems that the two core drivers, which have always been, at least for the last decade or so, have been there. Is one is the convenience that telehealth mechanism or mode of delivery provides to the patient and to the provider. I mean, they just not to have to travel somewhere and all that. And the other, of course, is the fact that shortages of certain specialties in certain areas. By doing telehealth, you can have access to a specialist that otherwise you may not have had. So for those two reasons, you've had telehealth in a while. But what has happened in the recent few months, what we're seeing is, because of the safety perception, at least, and maybe really so, patients don't want to come into a physician's office and get exposed to fellow patients in the waiting room, and of course providers don't want to be exposed to a sick patient, who may not even know they are going to be carriers and all that. So safety concerns, and then of course what has become easier is some of the regulatory burden of allowing telehealth reimbursements and all that have just gotten eased. So those two recent trends have just kicked it harder right now. So that's what it looks like right now for growth.
Great. All right. So Arun, how are you seeing this view that Heman's saying, and are you seeing the same thing from your viewpoint, or is it slightly different?
Well, it's I go back to just the technology adoption. Telehealth was never about lack of technology. It was more about too much regulation or not consistent regulation. So it was only used in two settings that I know of. It was in rural areas where access was important and you didn't have enough critical care or alternate facilities. And then the second one was in inpatient settings inside hospitals. Providers could use telehealth for consultations and such. But what I'm seeing now across the board is, first and foremost, all states have removed temporarily their licensure requirements to allow cross-state providers to provide telehealth services. You only now need, in most states, just an oral consent from the patient. It used to be that you had to have seen somebody physically before they could give you consent. Now you can be the first-time provider and you can be across state lines and you can still get a verbal consent and go on and provide telehealth services. Not only just MDs and DOs, but really registered nurses, APRNs, any of those care providers are now allowed in most states. So that was a big change that happened, again, driven by COVID. The second I've seen is that CMS has actually added a particular CPT code, which is sort of a billing code that they have for each of the process and procedures. CPT stands for Common Procedural Technology. They created a special CPT code to allow billing for these services, including just a phone call, right? So in fact, a colleague of mine was telling me yesterday that her physician, for the first time in 30 years, called her as a part of just regular checkup and was able to get reimbursed by both private payers as well as CMS. And the final one is that we are also seeing providers being able to prescribe these controlled substances, what they call prescription schedule 2 and 4, 2 through 5, which is again, if you had left it to its own, these types of regulations could have taken decades to come about, and that all has happened in a matter of few weeks.
Interesting. Emmett, do you have any interesting stories from your, related to these facts?
Well, I have many stories. So let me actually acknowledge for this audience that I have two roles that I play. One is, of course, I run Synerzip in my day job, and we work with healthcare clients, and I get to see telehealth with clients like Vocera and Arun and many other clients, and that's my day job. But then I also have a other job, which is I'm a unpaid technology consultant for my wife's pediatrics practice. And that practice has been an early adopter of technology going back to the EMR adoption 2 decades ago in their case, and now telehealth and all that. So I get to hear a lot of stories. But one story actually, which that comes to mind, which is interesting, is in the last 2 weeks, as patients have decided to kind of resort to telehealth because just more convenient for them. They're scared to go into physician practice and all that. So one of my colleagues, his wife, a few days ago, less than a week ago, she had a stomach pain. So she, of course, avoided going to physician and thought it was something gas related, something mild. It didn't go away. A day later, it became worse. So, but she still didn't go to see her doctor, but she did do a telehealth visit. So and now in the telehealth case, of course, if you have a repeat patient, that's pretty easy to do, and all reimbursement, everything Arun said, has made it easier for patients to consult a physician. She did, and of course, doctor gave whatever advice, and she went off. The next day, she had even more excruciating pain and ended up going into urgent care, and then within a matter of minutes, as they did some tests, ended up being sent to ER and then into surgery, and had 2 surgeries. Turns out she had ruptured appendix. And so the point is, by going into telehealth, avoiding to go to see a real patient and actually just settling in for a telehealth visit because you could do it, sometimes you end up on the that's not a good idea. So I think we have to be careful that for certain situations telehealth is wonderful. For other situations, you have to just make sure you actually go in and get it, because if she had actually seen her physician, they would have probably picked up on the fact that it is appendicitis, and she would have probably not needed that severe 5-day of hospitalization for the infection that spread and all that, which was much worse situation. Thank God she's fine now and recovering and all that, but I think that's one downside of telehealth. I think that we just have to be careful how to set the dial for appropriate level of telehealth while physician interaction is important.
Absolutely.
Yeah, I get in trouble for going to WebMD and self-diagnosing. My wife does not like that. It's a similar problem, right?
Right. Yeah.
So we have a question from the audience. So Sean is out there. Sean, do you have a question for us?
Yeah, is there a difference between telehealth and telemedicine?
Yeah, that's a good question. So the way I understand, Sean and others, is that telehealth is a broader category, and different specialities, whether it is pharmacy, there is something called telepharmacy. We have a client, we work with them on telepharmacy. Telemedicine is for medicine, then of course psychiatry. So different speciality within the field of healthcare all have their tele version, and telehealth is the umbrella term that applies to all of them.
Makes sense. Good question, Sean. So Arun, this question's for you. You mentioned that there's a rapid acceleration of technology adoption in healthcare. Do you think this pace can be sustained?
Yes, I think in a lot of areas, including healthcare, what we're seeing is acceleration of stuff that would have taken 5, 7, 10 years in a normal cycle to get pulled in forward. We've talked a lot of hospitals as part of our value chain, and what we're seeing is a complete rethink of priorities for a lot of the health systems. What they had to do in the short run was really, for example, completely shut down their normal services for money-making operations like elective surgeries or treating chronic patients, and redirect all the resources in the short term to COVID-19. Obviously, that's not sustainable. So these hospitals are thinking about reprioritizing how they're going to offer, first of all, how they're going to protect their front line. That has become one of those never again events that is dawned on hospitals. And then the second effort is to make sure that if a pandemic like this happens again, which it sure will, there might even be a second wave, most people think, in several areas. How do they make sure that the rest of the functioning of the hospital continues to happen so they can continue to generate revenue, address the needs of the population? We've talked about, I've heard conversations where hospitals want to be able to set up instant capacity of 2 to 3 times their existing bed capacity in a matter of a week, what they call alternate care facilities. And the other problem of making sure the frontline workers remain well protected. There is legislation that is being talked about in Washington, D.C. of how to make this PPE equipment, sort of a must-have, and Vocera is helping in a lot of those areas. I can give you some examples of how we've helped hospitals with both those priorities. But yeah, it's here to stay. And actually, one of my nurse colleagues was telling me the other day, back when AIDS started to become an epidemic in this country, hospitals started to have certain change in policies and procedures for protecting their frontline workers, and the use of gloves became a mainstay in the hospital. That was like a small change, but since then gloves have become sort of the mainstay in the hospital. Same thing is going to happen now, not just this protective gear that you see, but use of technology that enables some of those opportunities. Sorry, that's my badge that went off. Those opportunities will have to be make sure that the frontline workers are able to take care of the patients without having to be in harm's way. And so protective equipment will include things like communication equipment as well as all the things that you see. But it's here to stay.
Yeah, I see. So that badge you have, is that like an example of a communication device that helps folks?
Yeah, this is part of what we deploy in hospitals. It allows caregivers to always remain in constant touch with anybody in any role by simply using their voice command. They can just say, "Okay, Vocera, find the nearest respiratory therapist," that type of thing.
Neil Mitra. I'm sorry, Neil Mitra is not logged in at the moment. Would you like to send a page?
No, thank you.
Would you like to leave a message?
Anyway, that was just an example of what we can do. Right?
It's very cool.
So imagine if you're wearing a protective gear. This is inside. Yeah. You don't have to touch anything. You can have a communication with anybody in the hospital or health system.
Yeah, very cool. We do have another question from the audience. This one's coming from Pankaj. Pankaj, you want to ask your question?
Yeah, this question for Arun. So is the adoption of telehealth varied by the healthcare segments? Are some areas growing faster or slower than others? When I mean by healthcare segment means like hospitals or residential care facilities or home health care in different segments. What do you see?
I wouldn't be able to comment on other segments since we mostly focus on health systems. But it is definitely true that almost every health system we talk to is looking at ways to, as part of protecting their frontline workers and providers, to include as much of a communication at a distance approach, including telehealth, as I've ever seen. So this is definitely a big change that we've been noticing.
Yeah. So Hemant, from your experience, do you see more segments? Like, do you understand the segments and how they're growing?
Yeah. So I look at it slightly differently, at least the way I have observed it again through my work Synergy work and working with technology company, but also as a technology consultant to with my wife's pediatrics practice. The three kind of a specialities that seems to be the more easiest and earliest adopters that stand out. One is, of course, behavioral health. It's just easier. Patients feel safer or have less stigma on a telehealth call to in a telepsychiatry call, actually. So it's much easier for them. Of course, the psychiatrist will rather see a patient in person, but the patient feels more comfortable doing a telehealth call. So that's one segment. Other is dermatology. It just turns out if you have a rash or something, it's so much easier to do a FaceTime call or some sort of a video call, or take a picture of your rash, zoom in, and your dermatologists can do a pretty good job these days. The quality of video and audio and still pictures is so good that seems to be a very easy way for dermatologists to adopt telehealth. And then third is, of course, pediatrics. So what happens in pediatrics is two things that make telehealth easier. One is the patient starting from newborn to all the way to teenage years and all that, especially in the early years, newborn to toddler years. It's much easier for parents when it is a late night and the child is throwing up and all that, instead of running off to an ER and to see a real physician, for them to do a telehealth call. So it just is so much more convenient for in the pediatric setting for a parent to consult a pediatrician. And also what happens in pediatrics is there's a relationship between the pediatrician and the patient and their parents over the course of 18 years. So if you can mix a telehealth visit for periodic checkups and coughs and colds and ear infections and all that. It's because your pediatrician already has all the prior records. They have the full record, they have the history of the patient. So for a pediatrician to see a new or a repeat visit for an existing patient is much easier for them to do a good job of diagnosis. So in these three areas, dermatologists, pediatrics, and behavioral health, it looks like telehealth is a much better adoption. Yeah.
I see. So since your wife is in an individual practice, what are you seeing as far as trends, like pre, during, and now, as we're starting to open up? Are you seeing different behavior in the people that are coming to the office or using telehealth?
Good question. She in her case is a part of these are three pediatricians, and their practice has been one of the early adopters of all technologies, including EMR and even telehealth before pandemic. But her pattern pre-March timeframe was occasional telehealth call. Every so often over the weekend, even if she's not on call, she would have a telehealth visit where someone has kid has a rash, and she would look it over and do a telehealth visit with that patient and so on. But it was occasional, nothing systematic. And in the months March, April, May, last 3 months, it became almost 50% of our volume was telehealth, because of the reasons patients under lockdown situation or otherwise consideration didn't want to come into the practice. So 50%. Now within last couple of weeks, as things have started opening up, patients she's observing, and I'm hearing these stories now, patients, even though they could do that visit as a telehealth visit, they're preferring to come into office. So there is a certain comfort of seeing a physician and having a physician do an examination and talk to you. So I think the dial went from almost zero, even though she was doing some telehealth, almost zero, to 50-50, now to a stable equilibrium, probably of 80-20, which is 20% of her patient consultations will be telehealth, 80% will be still in person, and those 20% will be the repeat patients where she actually has the history of interactions and patient record and all that. It's just that this one visit this quarter is going to be on telehealth because it doesn't need to be in person. Next one will be back to in person. So I think the mix is going. That's what it looks like right now based on this anecdotal evidence.
I see, and that's interesting. So let's go to another poll. I thought I had a follow-up question for you, but I lost it in the shuffle here. So another poll coming up: has telehealth impacted your roadmap? So this is more specifically like, are you seeing, you're in engineering team or product management or in healthcare in general, are you actually seeing a real impact to your roadmap? With that, so at the individual practices, that makes sense that these kinds of behavioral changes are happening. Is there a difference at the hospital level, Arun? What are you seeing there?
Yeah, in the hospitals, one of the biggest things that has happened most recently is, well, actually two. One is as the hospitals have to expand their capacity almost overnight and set up these alternate care facilities. You might have seen tents being set up in the parking lot, or Jarvis Center in New York was taken over by the military to set up these beds. The problem of having patients be able to communicate with their caregiver became very prominent. So, if you noticed in a hospital room, you typically have a headboard and you have all sorts of equipment, probably almost too expensive equipment, one of which is this bed speaker that allows a patient to press a button and then connect to a nurse instantly. And it usually goes to nurse's badge, like the Vocera. When you move into these alternate care facilities, there is no ability to do that. You basically have a bed and maybe a little IV stand. So what we've done is, and this was part of the pivoting of the roadmap, I think, which is kind of tied to this question, is how do you make this device such that when you press the button, it automatically always calls a specific nurse associated with that patient. So we were able to quickly make those changes. And now each of those beds, they basically zip tie one of these things to the bed rails, and a patient can press that button and it'll always connect to whoever is the nurse that's taking care of that patient right away. So that's an example of not telehealth, but again, allowing this distant communication to happen using technology. The second problem that hospitals are trying to solve is connecting patient families who obviously cannot visit their loved ones in the hospitals. And again, how do you use some types of technologies to allow those caregivers to have a limited access to communicate important information to the family members who are otherwise, completely in the dark of what's happening to their loved ones. So both of these areas are now becoming sort of front and center for use of technology to allow this remote communication to occur.
Yes, we have another question from the audience. This time it's from Subu. Subu, do you want to ask your question?
Sure. Sure, thanks. I have three questions. First is, are video sessions mandatory for telehealth consultations?
No.
Are there any compliance requirements as a result of doing that? My second question is, as a patient, how do you assure that I'm talking to a physician at the other end? Because it may be anybody. So I don't know. So which scares the daylights out of me as to why I should adopt telehealth.
Valid. No, it's a valid question.
My third question is, especially to Arun, he mentioned it briefly. Are the charges for telehealth consultations same as in-person consultations? So these are my three questions. Thank you.
I'll take a. So yes, video is not a requirement. Telehealth today includes even a simple audio call. It can even be what they call asynchronous communication, just sending a text, a secure text to a patient or a patient family, or having them visit a portal to pick up some documents or prescription. All of this, anything that allows remote communication, ability to diagnose, is all under the old umbrella of telehealth, except, as I mentioned, regulations have been temporarily put on hold and things have accelerated to where you allow audio calls and you allow audio, video, or any of those things to be considered as part of telehealth. The second question is a good one. If you have a video, obviously you can validate and authenticate you're talking to a doctor, but that's why not all states have allowed audio access as part of telehealth reimbursement, but some have. And I think it's really left up to the patient to be able to cross-authenticate the person they're talking to. Especially if you've never seen the doctor before and you don't, have never visited their facility, you are kind of flying in the dark. But hopefully that's not being abused given the circumstances by any of the providers. On the reimbursement, as part of this public health emergency, PHE, CMS has, at least from Medicare standpoint, allowed equal reimbursement for telehealth services. It used to be, I think I remember reading, it was 45 cents on a dollar in the past. The reimbursement rates were actually limited, but now they've removed those restrictions because they really don't want people to be either going without care or having to, you know, drive to the facilities where we don't want unnecessary patients coming in.
Great, thanks.
Yeah,
Yeah, thank you. Good questions.
Mike, let me add a couple of answers to Subbu's question on the topic of are you talking to the doctor? So what the mode seems to happen is that often two things happen, two alternatives. One is the call is being initiated through the EMR system already. So it is the doctor is actually in front of their EMR, so it's authenticated, and they're initiating a telehealth call through that mechanism. So it is HIPAA compliant and all that stuff. So I think less chances of that issue. The other is what I often also see pattern is outside of EMR system, they're doing a FaceTime call or even a Zoom call with the patient. But in those cases, the patient and doctor actually have a ongoing relationship. It is the same patient, but they just have some sort of a quick consultation, and they're doing that. And therefore, there's no concern whether they're talking to the right physician or not. They have a relationship. They know each other. It's like talking to a friend. It's just that instead of in-person visit, you're doing it over a FaceTime. The other thing about reimbursement, what I'm noticing, this is specifically through my wife pediatric practices, telehealth calls tend to be shorter. If the patient had come into office and had a full consultation, it may have been a 45-minute time slot, and they would code it a certain way for reimbursement. Telehealth maybe 15 minutes, so they get coded at a lower level and get reimbursed at a lower level. But then, you know, it's just fair way to do it because 15-minute quick telehealth consultation. So that also seems to be the pattern right now.
Yeah, thanks for that, Emmett.
Great, thanks.
So let's see the results of our last poll.
That's interesting, yeah.
Has it affected your roadmap? So no impact, modest impact, and significant impact. So I do understand the significant impact. So this actually makes sense depending on where you're at. Maybe you're already, you know, moving in a positive way or towards telehealth anyway. I can see that.
Mike, I'll give you another example that just remembered. It's not directly related to the products or the use of the products or technology in healthcare, but one of the things that we've had to really think through again is how do we make a sale in health systems where nobody's invited, our salespeople cannot actually go and have meetings inside hospitals anymore. How do you bring to life the experience of using a product, whether it is Vocera or any, to the audience, and how do you engage with them remotely? You can only show so many videos, but ultimately people want to engage. So we've had to rethink some of those aspects also of how do you do remote engagement during the sales cycle. And we've used Synerzip's help in this particular case to allow us to create that virtual environment so we can bring a hospital room to life as we are demonstrating the technology and allowing the users to interact with it over a Zoom session. And so that's another sort of area where we had to certainly quickly pivot and invest, because otherwise we wouldn't be able to sell much in the current environment.
Yeah, so Hemant, following up on that, do you have any other examples within Synerzip where we're helping people pivot their roadmaps or accelerate or accomplish some of these short-term needs?
See, most of our work with our clients has had some level of telehealth related items in the roadmap already. Of course, some of the things got pushed harder. So telepharmacy has been a common use case for one of our pharmacy systems clients, where their use case has been that in remote locations where you need to consult a pharmacist for some specialized medication and all that, you don't have access to a registered or a licensed pharmacist in that town, and then allowing through your pharmacy systems to consult someone remote and have a full information session with them and all that. So that has been something we have been doing for a while. We have seen, of course, in other industries outside of healthcare also, retail tech has to change quickly to adapt to it, ed tech, remote learning and all that. So we have had, in terms of helping our clients pivot quickly, aside from the example that Arun shared about Vocera being able to sell effectively in the hospital settings, we've had a lot of, and being agile in our work with our clients, we've been very effective in helping all of our clients quickly adjust their priorities and roadmap and still continue to conduct business in an effective manner with us.
Yeah, that's great. So I don't think we have any more questions from the audience. I think we're out of our content, so like let's just slowly wrap this up.
Yep.
I want to thank Hemant and Arun for joining us. Very insightful conversations. Look forward to maybe having an opportunity to chat with you all again.
Thank you.
We do have an upcoming Zip chat coming in a couple of weeks. Feel free to attend that one. It also looks interesting. And as a final parting gift, we're going to give you our contact information. So if you want to reach out and ask any direct questions of any of us, you'll have that ability to do that. Thanks again for everyone for joining. And again, Hemant, Arun, thanks for taking time out.
Thanks, Mike. Thanks, everyone.
Thanks all, guys. Be safe.
Bye.
Bye.